Hello, my dear brothers. Welcome to today's event. I can see that many of us are already online. Our speaker is here, but somehow network stream also is going to join us again. While we are at it, welcome. Where are you joining us from? Can you just tell us? Where are you joining us from? Where are you joining us from? Type in where you are joining us from. If you can hear me, first, can you hear me? Oh, okay. Hudu, Kaduna, nice to have you.
Hello, sir. Hello?
Yes. I'm with you.
Hello, can you hear me?
Yes, I can hear you.
Something and yes, it said the mobile was blocking me.
Oh. Okay. Kenneth is from Kaduna. Ebenezer is from Lagos. Benjamin is from Jos. AK Musa is from Wari. Good to have you. Philemon is from Kaduna. Don't worry, we'll get this thing sorted out and we'll go on. Our speaker is here. It's a network, as you can see. So let's keep sharing where we are from. Okay, Nda is from Abuja. It's nice to see you, Nda. Welcome. Thomas is from Ilorin. Wow, it's all over the nation. This is a serious business that every man should ensure is part and parcel of it. Farouk is from Lagos. You are all welcome. Like I mentioned earlier to those who joined, we are having some technical issues, but you know, we are in Nigeria and network can be a different thing. Okay. Okay, Abbas is from Abuja. Fred is from Kaduna. You're welcome.
Hello, sir.
Yes, I'm with you. Can you hear me? Can you hear me?
Hello, sir.
Yeah, I can hear you. Can you hear me?
Yeah, I can hear you now. So I
Okay.
don't know. It's really not giving me that option. So I don't know if it's because I'm not registered with it.
No, it's not supposed to be so. Whether you're registered or
Okay, let
not,
me
you should be
see
able
if
to
I
share your
can,
screen. But
maybe if I can change the orientation of my
your phone, right?
say yes. Let me change.
Okay. People are
That
joining in
changes it.
on YouTube, so let's see how it goes. I'm trying to see.
Okay, another option is I can send the present.
Oh yes.
While I talk. So can I send it to you on WhatsApp now?
Yes, please do.
Oh, okay.
So I will upload it from here, then we'll go on.
Okay.
Yes. So Dauda is from Lagos. You are welcome. So welcome all of you. We are trying to put everything together to ensure that we have a wonderful time together.
Okay, I've sent it to you, sir.
All right, I've seen it.
Okay.
All right, I have it now, so I'll share it from my end. Network, don't do anything that is not. Okay, we have Joe from Lokoja. Nice to see you. We have 30 people online. We have about 670 people in the group. I think all of us, at least let half of us be here. But then we're not going to wait for others. So let's wait for the network. Maybe it's giving us some issues, but don't worry, we're going to have a nice time. I can assure you about that. Okay. All right. So let's get started so that we don't take too much of the time of everyone that's here. We want to welcome everyone to this presentation. Our speaker is Dr. Dominic so far. He's a consultant urologist with Barau Dikko Teaching Hospital, Kaduna. It's a big pleasure to welcome him to speak to us today on the silent threat, understanding prostate, and why men must act early. We are a group of men above 40, that's the target, and prostate health, as all of us are aware, is something that affects every man. And you being the specialist in this area, you are a body of knowledge that can help us gain better understanding of the situation of our prostate. So we reached out to you, and graciously you accepted to speak to us. It's a great pleasure, and we are very happy that you are giving us this time to talk to us about this important part of us as men. So
my pleasure.
You have, thank you very much. So you have shared your slide. I am going to put it up, and of course you can take it over from there, introduce yourself, say whatever you want to say. So in the next 40 minutes to 50 minutes, let's see what we can learn, and as people ask questions, we will compile them. I'll also show them on the screen. You'll see them and you can answer the question. So are we ready to go, sir?
Yes, we are. Thank you very much. And my pleasure. It's really an honor to be here and to share with men what I have acquired through the process as a urologist. And I believe at the end of it, we'll be better enlightened and educated, I myself inclusive. And at the end, everyone will be the better for it. Knowledge is never wasted. And I believe we're going to get more knowledge here. So,
all right, thank you. So I'll go ahead and share the screen now.
Sure.
Here we are. We have the screen here. We'll go full screen. And this. I want to be showing only your
slide mode. Okay. So thank you very much. Can I go ahead?
Just a moment. Yes, you can go ahead now. I think we are on full screen, right?
Yes, we are. So can I go ahead?
Yes, please.
Okay, thank you very much. So as you can see, and as he rightly said, I am Dr. Sofa Dominic Daniel. I'm a consultant urologist with Barau Dikko Teaching Hospital in Kaduna. And like so, as the topic clearly states, the silent threat, understanding the prostate and why men must act early. I chose to subtitle it "Taking Control of Your Health Before It's Too Late." Next slide. Now, as you can see, this is the diagram of the male genitourinary system. It is closely linked to the genitalia, genital system, and the urinary system, and that is why it manifests. It's useful in the as in reproduction, but at the same time, also can affect the urinary system. So if you look at the diagram there, the topmost leveling we can see there is the bladder, and just beneath the bladder is where the prostate is situated. If you look beneath this prostate in the diagram, you will see that there is a tube running down out of the prostate, below the prostate, and that's the urethra where urine passes. So urine passes from the bladder, goes into the urethra, part of which is inside the prostate, and from there it goes to the exterior where a man passes it out. Now, because the urethra, which is a tube that conducts urine, passes through the prostate, anything that affects the prostate can or potentially affect the urination of a man, and that is where this is very important. Now, aside that, we see that there are other parts uh, of a man that are closely related to the prostate. The bladder, like I said, then if you see posterior to the prostate is the rectum. The rectum leads to the anus. So that's why many a times we can just put our finger through the anus and feel the prostate, as we will mention later when we come to how screening is done. So that's because of that closeness, that proximity between the prostate and the rectum, it's possible to feel the prostate through the rectum. The prostate itself is quite small, about weighs about 18 to 28 grams in size. It's like commonly said the size of a chestnut. So that's small if you look at it. However, it continues to grow in size as men get older. In younger children, in boys, before puberty, the prostate is even much smaller. At puberty, it increases more rapidly in size and then continues to increase as older. Now, part of the problem that can occur from the prostate is as a result of this continuous increase in size of the prostate. So every normal man, and when we say normal, the man that has his testes that is functioning well is likely to have his prostate continuously increasing in size. Now, what does the prostate do? The prostate essentially produces some hormones, part of which is the PSA, the prostate specific antigen, which we use in some of the tests we'll look at later. Then also, it secretes part of the fluid that forms the sperm. So once a man ejaculates, it's not everything that comes from the testes. Contribution of the sperm cells come from the testes. Then there's also the seminal vesicle, which contributes to the secretion. Then the prostate also contributes to the secretion. So it's a combination of all these secretions that come out as the ejaculate that we call semen. So the prostate contributes in that. So what the prostate uh, secrete also helps in the survival of the sperm cells, especially outside after it has been ejaculated, when it's outside of the man. So the prostate does perform some important function, and that's why we need it as men. Next slide. Now, what are the common problems that arise from the prostate? One is benign prostatic hyperplasia. Benign prostatic hyperplasia is a non-cancerous enlargement of the prostate. And now this is the commonest uh, problem arising from the prostate. It it's 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 what most people that have prostate issues complain about. It occurs just because the prostate increases in size. But let me correct a common misconception here. People just come and complain, oh, my prostate is big, probably because they had an ultrasound scan, and then they are worried. Yes, if the prostate is big, it's more likely to cause a problem. However, it's not about the size of the prostate. It is whether there is an issue, it's causing a problem or not. What I'm saying in essence is that somebody may have a very large prostate, and if it's not causing any problem, he may not require treatment. Another person may have a smaller prostate, but it is giving him great difficulty in urination. That is the person that requires treatment. So if your prostate is large, however, you don't have any symptoms, you pee fine, no issues, then why treat? So people sometimes go do an ultrasound scan and they say your prostate is big, but you don't have anything, you pee fine, nothing, and then you're anxious and scared and worried and all that. Another misconception here I want to raise is that some men believe that if the prostate continues to enlarge, and unfortunately some doctors even say this to patients, it's not true that if the prostate continues to grow bigger, it can become cancerous. Prostate cancer and benign prostatic hyperplasia are have two different pathways. Yes, they can coexist. However, one cannot lead to the other. So it's it's important that we understand this going forward. So back to what we're talking about, benign prostatic hyperplasia just essentially means enlargement of the prostate. Now, as it enlarges, from the previous diagram, we know that the urethra passes through the prostate. As it enlarges, it can compress on the urethra. As it compresses on the urethra, it begins to make urination quite difficult. And that's when the person begins to have some issues passing urine. You go, the stream is poor, or even when it comes out, if you strain, it may even cut off the stream of the urine. Sometimes again, the the man is unable to pass urine at all. You feel the urge to urinate, the strong desire to urinate. However, you go to pass urine and nothing is coming out. So all this can happen because of enlargement of the prostate. So that's benign prostatic hyperplasia. It is non-cancerous. Then the other one is prostatitis. Prostatitis essentially means inflammation of the prostate, and this inflammation occurs from infection. Typically, this presents with severe pain during urination. Uh, there can be difficulty, of course, because of the pain during maturation. This prostatitis can actually be acute or chronic. Acute is one that is occurring with pus or some suppuration occurring within the prostate. The chronic one is caused by other organisms. The pain may not be as severe as in the acute phase. But essentially, from organisms, and this occurs. Often it can be treated with antibiotics, and the patient will feel better. That also is not cancerous. Then the chief of them is the prostate cancer. The most problematic issue, if you allow me to put it that way, about prostate cancer is that it is silent. Prostate cancer in its initial stages does not give any symptom. It has advanced to a certain degree that it begins to give symptoms. And that is why we will talk about screening later as one of the things men can do to uh, prevent themselves from having any regrets on this issue. In fact, it's been projected that prostate cancer kills 1 in 9 Nigerian men. So out of every 9 Nigerian men, one is likely to die from prostate cancer, and that's quite significant. So it points. I mean, this is one of the reasons I believe we're having this discussion. Next slide. Now, prostate cancer, the silent killer. Like I said earlier on, often no symptoms in the early phase. It often spreads before it can be detected. Now, in Nigerian men, it's the second leading cause of cancer death, and the risk of developing prostate cancer increases with age. So it's commoner in advanced ages. People with family history of prostate cancer are also more at risk of developing prostate cancer. Then ethnicity, typically the black race, it's commoner and even more severe in those in the black race than the Caucasians. Uh, than the Caucasians. So this is one of the risk factors. Now, by the time symptoms appear, it may be, I said maybe, not always, but it may be too late by the time one begins to have symptoms. And that is why we shouldn't wait for symptoms to be able to identify prostate cancer. Next slide. Now, what are those symptoms that can be seen in all of these prostate conditions that I mentioned? One is trouble starting and stopping urine. When we say trouble starting and stopping urine, medically we call it hesitancy and then terminal dribbling. Hesitancy is starting urine, terminal dribbling is stopping urine. So one goes to pass urine and you notice that you have to wait for some time before the urine starts coming out. This just means that your bladder is trying to gather energy and increase the pressure within the bladder for it to overcome the resistance the prostate is giving it so that urine can pass. So that's what causes that wait period, that hesitancy. You go and you're unable to start urination immediately. Have to wait for some time. Bladder builds up the pressure, then the urine starts to come out. Similarly, stopping urine. One wants to stop urine. Instead of being able to stop urine cleanly, you find that it continues to drip for a very long time. Yes, there's a normal drip that can happen, but by the time it's taking too long, still dripping before it stops, you also know that there is an issue. Then the stream of the urine may be poor. You can't project the urine far. It just drops in front of you as you're trying to pee. It's because of the resistance that the prostate may be offering. Dribbling of urine may also occur as a result of this. Then frequent urination at night. Usually this is the time that men start coming to the hospital. When the urine begins to wake them up at night several times, they have to wake up several times at night and it disturbs their sleep. Usually that's when they start coming to the hospital. And that's not a good time. Once you start noticing reduction in stream and all that, come to the hospital so that you be evaluated. It's better to come and you're told there's nothing wrong than to wait and then learn that you should have come earlier. Then there are other features you may see: blood in urine, blood in the semen. Okay, this actually connotes some form of advanced disease. Once pain, blood in the urine drives men to the hospital very early. So let's not wait until that point. Erectile dysfunction may occur in advanced disease. Pelvic pain, especially in prostatitis, can be seen, like we said earlier, but often no symptoms with prostate cancer. Still sounding a note of warning. Next, please. Next slide. Now, what are the risk factors? We mentioned age greater than 50, but in Africa, we consider 40 because, like I told you, among the black populace, the risk is higher. So in the West, they use 50. In Africa, we use 40 as the age within which we need to start looking out for prostate cancer. Family history: if you have a father or a brother that has prostate cancer, the risk is multiplied twice. Okay, you are 2 times more at risk than an individual that does not have this history. Okay, African descent, told you, especially in the West, 1 in 6 lifetime risk for Africa, while in the West it's about 1 in 8. Obesity: there have been relationship. Some have tagged obesity, found there is increased risk in individuals that are obese. This is because obese individuals secrete within the fat some form of hormones that aid the growth of the cells lining the prostate, and this rapid growth can lead to mutation, which leads to cancer. The same thing, dieting, eating too much fat, of course, will lead to obesity, but on its own also can increase the risk of prostate cancer. Diets that are low in fruit, that are low in fruit and fiber, also have been identified as increasing the risk factor. So it's good for us to take fruits. It's good for us to take fiber. Smoking is a risk factor in almost every cancer. Prostate cancer is not an exemption. So there's also increased risk in individuals that smoke. Next slide. Now, having known all this, what can we do to save lives? Screening. Screening. But I'll need to sound a note here. Screening for prostate cancer is not as widely acceptable as we have for some other cancers like breast cancer, cervical cancer, for some reason. I'll just give a few. One is that prostate cancer is a slow growing disease. And there are men that may have prostate cancer that may never progress. That is, if you check them, you find out that they have prostate cancer, but that cancer is unlikely to progress. There are also men that have prostate cancer but are unlikely to die from that prostate cancer. So because of that, there is what we call overdiagnosis in prostate cancer. Overdiagnosis simply means you diagnose somebody and treat him, but if you had not diagnosed him, you will live his life and leave this world without ever knowing he has prostate cancer. So it's because of some of these individuals and the nature of the prostate cancer that there is some controversy as regards screening of prostate cancer. But data has shown in the West, where screening is done, the individuals with advanced disease are much less compared to this part of the world. People dying from prostate cancer are much less compared to this part of the world. So that's the argument some people use and say, no, screening is beneficial. So most guidelines are that prostate cancer screening should be individual based. The person that desires it goes and gets his screening done. And that's why we don't often see prostate cancer screening the way, I mean, being advertised in public health fora as you have with prostate cancer. One of the is the PSA. It measures the prostate specific antigen, one of the hormones that the prostate produces. Now, the hormone is high in individuals with prostate cancer. As a cutoff, once the PSA of an individual is greater than 10, we advise the person to do another test, which is the prostate biopsy, to check whether there is prostate cancer or not. If it's much lower than that, if it's within the normal, we may not ask for that. And the normal is between 0 and 4. So between 4 and 10, your urologist will look at other things and decide whether you should do the biopsy or not. But less than 4, likely no biopsy. Greater than 10, biopsy indicated. Between 4 and 10, there are other things that will be looked at to determine whether you qualify for the biopsy or not. Now, one of the other screening tests we use is the digital rectal examination. When I was talking in the anatomy, I told us how close the prostate is to the rectum. So, in the digital rectal examination, finger is stuck through the anus into the rectum, and the prostate can be felt. And this the doctor does because there are some things you feel within the prostate and say this prostate may be cancerous. And if you don't feel those things, it doesn't rule out that it's cancer. It may just be in the early form. But if you feel it, at least your suspicion is high. And you can tell the person to still go ahead and do the biopsy. One of the arguments for screening is also that studies have found that screening decreases the mortality by about 40%. So, amongst urologists, there are arguments for and against screening, but it's generally accepted that once an individual has an increased risk, he should screen. Next slide. Now, with all this knowledge, we ask the question, if this is it, why do men hesitate? And I brought up this so that we'll ask ourselves these questions. Am I hesitating? And why am I hesitating? Do I fall into any of this category? One is embarrassment. I've had men that have come to clinic probably because of where I am, this part of the world, and they have felt they have declined digital rectal examination. So some men will ask, I will go and a doctor will stick his finger into my anus. No, I'm not going. You know, so the embarrassment of digital rectal examination might have just been what is keeping us. But if you understand the importance and what it can do, then I believe it shouldn't be. Then some men just believe, let me be ignorant. If I have it, let me just not even know. At least I'll not have anything to worry about. But it's a disease that once discovered early, the chances of cure are high. If it's discovered early enough, treatment can be given for cure. But if it's discovered late, chances of cure very, very low, highly unlikely. So early detection, very important. It will go away. This is a myth. It won't. If it's there, it's there. No symptoms, no problem. So people will say, oh, I don't feel anything. I pee fine, this and that. We say no. The initial stages of prostate cancer are asymptomatic. So men will have to act even before the symptoms start appearing. And what do we advise? In this part of the world, once you are above 40 years of age, you should do a PSA test. If you do the PSA and it's within normal, fine and good. You may be asked to repeat within a year or even 2 years, and that suffices. If the PSA is above normal, then you will now be required to do the biopsy, which will now check to see if there's prostate cancer. Now, cultural taboos regarding male health and aging, sometimes either personal beliefs, cultural beliefs may just be the hindrance to men coming to seek medical care. A note of warning there: ignoring it is not bravery. You're just harming yourself. So let's not ignore it. If we are above 40, let's check. If we have symptoms, go to the hospital. Next slide. Now, what are the consequences of delay? The cancer can spread if it is prostate cancer. And like I said earlier, once it has spread, treatment cure is highly unlikely. And if it's not a cancer, for BPH, let's not forget that benign prostatic hyperplasia, the one I said is not cancerous, just enlargement of the prostate. It gets to the point that some men are unable to pass urine at all, and that's when they are rushed to the hospital. And then you have to perform one or two surgeries or one or two maneuvers just for them to pee. Then you now end up doing an operation. Some don't even come until this enlargement begins to bleed. It can happen, and that's what brings them to the hospital. And the worst of all, if somebody has been having this problem for long and it has affected the kidney, some of them will now start requiring dialysis for something that, I mean, you would have just prevented if you had come earlier. So let's not wait to till it gets to this point. Sometimes again, you see men carrying catheter up and down for things. For something that wouldn't have been like that if there was no delay. Then other conditions like the prostatitis can cause chronic pelvic pain, which is difficult to treat for us, and then infertility can also result from this. Now, just the note I have there, I said localized prostate cancer, 5 years survival is about 97%. Localized prostate cancer is prostate cancer that is just within the prostate. It has not gone out, and that's the early form. For people treated with it, 97% of them survive up to 5 years. But once it is metastatic, the prostate cancer has spread, only about 30% of those treated for this type survive up to 5 years. So you can see the difference, and that's why we must act early. Next slide. So I say here, act in your act now. Screen if you are above 40, see a urologist, and you can have this discussion at length with your urologist before deciding on the biopsy. Know your options, which I believe this platform is giving us the avenue to get educated and then know the options. So the options could be active surveillance or treatment if cancer is found. Then there may be lifestyle modification. Of course, it's important if you don't have it. Exercise, dieting, we saw avoid fat, eat whole grains, take fruits. Then weight, let's watch our weight so we don't become obese, and then talk about it with one another. Break the stigma. Talk to your fathers, talk to your sons, talk to your friends, talk to yourself. And I believe the more we are educated we are about it, the better we'll manage it. Next slide. Now, treatment, don't panic. If you're discovered with it, don't panic. There are treatments. Yes, of course, the earlier the better, but whatever stage it's discovered, we ought to take it and go with the doctor as our treatment progresses. For benign prostatic hyperplasia, medications can be used and surgery can be offered, and it's safe. Once everything is successful, the person goes on with their lives with minimal risk. For prostatitis, antibiotics can be used, pain is managed, and the person is fine. For cancer, if it's discovered early, there's surgery or minimally invasive route, and then cure can be achieved. However, if it's metastatic, then other forms of treatment, whether hormonal form of treatment or chemotherapy, can be used to better the life of the individual. Next slide. So, call to action. I call on you, everyone listening. Book for that screening appointment today if you are above 40. Don't wait. Talk to family, sons, brothers, and fathers. Share this message, break the silence, and then, most importantly, live healthier. Move, that is exercise. Eat smart. See a doctor at least once a year so that all this can be checked and we'll all be fine. Next slide. Okay, this is the last slide. Thank you. It says talk, act, and live. The time is now. The man is you. Thank you, everyone, for good listening. Uh, sorry, I took some time, but I believe it was worth it. Thank you.
Wow, thank you so very much. Let's get back on the screen again. Okay. All right. Wow. So very explicit, straightforward, clear, straight to the point. If you had any doubt before, now we have some clarity.
Thank you.
Thank you very much for that lucid presentation. It was very clear. Anybody can follow it. You know, sometimes when doctors make presentations, they use all those big terms that people now are lost even beyond what it was. But you never did that. What you gave us was straight to the point and it was useful. We are very grateful. Now, to
Thank you
us
very much.
who are participating, you're welcome, sir, in this. If you have any question, please type it in and we will ask. If you have any question, type it in and we will ask the doctor to answer them for us. Before now, we had some questions from the class, and although you made mention of them, I will still want to ask so that at least you give us some straightforward answers, straight to the point answer. Okay. The first question is
Okay,
what causes.
the network is not so good, so I didn't get a lot of what you said. Sorry, sir, but it's okay. Let's go
Okay.
on with the question.
All right. What causes prostate in men? Exactly as they ask it, I'm asking you. What causes prostate in men?
Sorry, I didn't get that. What causes?
Prostate in health, prostate problem in health in men. like I said, you answered them, but since it's a question that people have asked and some people just join, I want you to just talk about it. What causes the problem? What causes prostate problem?
Okay, now really it's not anybody's doing. There are so many prostate problems, but I listed the three major ones. The BPH, that's benign prostatic hyperplasia, that's enlargement of the prostate. That one, it's a consequence of just being a man. You really can't do anything about it. For every normal also increases in size. So whether you like it or not, your prostate will get bigger as you get older. And as it gets bigger, it can compress the uterus.
Network. Oops. So let's wait for network to bring him back on. I can see some questions here. Oh, it has taken him off. So what he was saying is it is a natural process. As long as you're a man, a normal man, and as you're growing older, the prostate increases in size. And that is what is the problem with the benign prostate hyperplasia, the increase in the size. However, benign prostate hyperplasia is not cancerous. So it will surely happen to men, but at different level, at different state. The second problem, which he talked about, is prostatitis, and that prostatitis is as a result of infection. So there's some microorganism that may have been responsible for that infection. And if a person is infected, he will have the problem. And how do you solve the problem? Of course, he mentioned it, that this can be sorted out using antibiotics. Okay? That it can be sorted out using antibiotics. Then the third one is the cancer, which to many of us may be aware, we don't have control over. Okay, sometimes whatever may be responsible for the cancer cells developing may not be known. Okay, so as it were, we cannot exactly say this is the reason for which a person has cancer. I mean, it is a known fact all over. Okay, I think it's finding it difficult to join us again, but we'll still keep trying. So we have some other questions which I will attempt to try and. Okay, I think it's back. So let me add him to the stage. The network has not been helpful to us. Okay. Sorry, we'll see that network is giving me.
Yeah, sorry, I was even completely logged. I just told me that there's a problem occurred. Okay,
Yes.
let's just hope it carries us on to this thing till we finish.
I hope so too. So here's another question. I'm going to show it on the screen. Kenneth is asking.
Yeah, so back to what I was saying.
Okay. Go ahead.
Yes. Is there any drug that shrinks the prostate? Okay, I will say yes and no. Okay, yes, because yes of the prostate. Okay, there are drugs we give that reduce the size of the prostate, and this reduction in size of the prostate is significant to improve the symptoms that the patient is having. Sometimes I don't like to use the word shrink, because shrinking gives an impression that it reduces the prostate to almost drugs can be given that yes reduce
Oh, network. Wow, it threw him out again. So he was trying to discuss, is there any drug that can shrink the prostate, and trying to tell us that shrinking does not necessarily mean making it smaller or otherwise. There's a question I'm also going to ask him in relation to that, and perhaps maybe we have a solution in that area. If it comes up, we'll look at it. So we'll just hang on, please. You know, you guys, we are in Nigeria, and sometimes network can be so funny to us and may not be able to answer all our questions. But there's one thing I'm going to do. If per adventure we still have issues like this, I'm going to pass all this. Sorry, network threw me out. Also, so here we are back. Okay, so what I was trying to say, I'm sure you can hear me. What I was trying to say, if we're not able to complete it with him joining us, I'm going to compile this question and share with him and get the answers from him. Okay? Okay. Now I can't see the questions anymore because I have to join with my other line. Can you hear me? If you can hear me, let's see in the comments. Okay. Sorry about that. You know, network is all doing its own. So my other laptop went off. Okay. Now there's this question about how about drugs they advertise on net saying it can shrink the prostate. Now, in my own opinion, sometimes some of these drugs that are being advertised have their own amenities as well. Is there still no audio? Can you hear? Can you hear? Tell me. I want to know. Aha. Okay. Thank you. Thank you. So unfortunately, the network cuts off, and oh, okay, good. It's back.
Hello, am I being heard?
Yes. Welcome. You know, we're talking about drugs that can shrink the, and you are responding to that actually.
I don't know if the network is from my end or there.
Can you hear me?
Hello, am I
I
being
will put
heard?
on the screen. This was the last question on the screen. Can you hear us? Wow. Oh, network has not been friendly, and this was going very smoothly. Wow. This was going very smoothly, but unfortunately, network is not helping matters. Okay, it's back. So we'll just go to the next question once is up.
Can you hear me?
So let's try this next. Yes, we can hear you. Yes, we can hear you. So here's a question, please. If you can hear me. Can you hear me? There's a
Yes,
question
I
on the
can hear
screen.
you now.
There's a question on the
Yes.
screen.
What's the normal range? Yes, I can see that. What's the normal range for overnight urination, right? Um, for overnight urination, once 2 times is fair. Okay, but once it's becoming on how once it gets to 3, there is usually if you start looking at there's likely a problem. But once or twice overnight, not a problem. And when we are talking of overnight urination, we are referring to when the person has gone to bed. If you stay up overnight, you're more likely to urinate what we're concerned about. So once it's more than 2, then once you start thinking there is something to um, worry about. I don't know if you got that.
Yes, yes, yes. There's another question again.
Okay. Yes, it says, does green tea have any role to play in managing prostate issues? Um, I mean, I will take it with a pinch of salt. I know that tea and caffeine increases, has some diuretic properties. And when we say diuretic properties, we're referring to um, agents that cause one to urinate frequently. I do not know the
Network.
exact in it. Yes, for green tea, I do not know the exact ingredient in green tea, but if it contains tea, then it can cause frequent urination. It can contribute to frequent urination. So one should stay away from it. There are drugs, there are natural herbs, okay, that have been proven to have some effect on prostate. But the problem, of course, we have with taking those medication is whether the doses are standardized, whether they contain other things, so the process of extraction and all that. Yes, but no doubt, in fact, some of the agents that are used in treatment of prostate cancer are uh, 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 extract from plants. So yes, there are plants that have effect on prostate cancer, but like we said, we have medication that have been tested, proven, and are being used. So I'm not a fan of those. I don't discourage my patients if they are using it to treat conditions that we can monitor and check. But for prostate cancer, I stamp my feet and say no. There's a standard treatment. If you let it that you're trying something, it will spread. And I do not want to be part of the persons you blame. But for benign prostate hyperplasia, if you say you want to do one other thing or other things, I watch and see and monitor you. I'll tell you, okay, come regularly, you can use it. If it's not working, I'll tell you, then we'll move to other things. But for prostate cancer, no, I don't compromise on that. Next, I can see a question. It says, does frequent sex cause prostate cancer? Um, it's something that has been on the social media. I remember a video that was released some times back. Even the National Association of Urological Surgeons had to wade in to make a press release. So now, as to whether it causes or prevents, that video was that it reduces the risk. There is no conclusive evidence. Some have done studies that said yes, it does. Some also have done studies that says no, it doesn't. It doesn't reduce the risk of prostate cancer. So as it is now, we do not have conclusive evidence that says that, oh, if one has regular sex, it's going to reduce the risk of prostate cancer. As it is, no conclusive evidence in that respect as it is for now. Yes, this question is coming back again. How about some drugs that they advertise on net saying it can shrink the prostate? There are a lot of things that come on the net. A lot of them are not true, and some are half truths. And because there is no punishment for anybody that posts an untruth on the net, people post all sorts of things. Okay, this. So we don't have to go trying things from people that are making all sorts of false claims. Okay. So verify whatever you see on the net before you submit yourself to it. That will be my word. People say a lot of things that are not true on the net. I've met people. Be careful that we don't fall victims to the, pardon me to use the word, fraudsters. I do have frequency. Yes. Um, when the weather is cold, because there is reduced loss. When the weather is hot, some people sweat a lot, and if you sweat a lot, you're likely to have less urine, so you're likely to go to pee less frequently. But if you do not, if the weather is cold, sweating is reduced. So because sweating is reduced, one is more likely to have frequent urination. That isn't every other thing to be as it was previously. So yes, that weather causes you to urinate more frequently is not a problem, and that's one of the things your doctor will also look out for if you come complaining of frequent urination. Look out for other things. There are other conditions not related to the prostate that can cause individuals to urinate frequently. Drugs, diabetes, for instance, and all that. So we'll look at for all these things and say, okay, it's more likely from this than from the prostate. But if we feel it's from the prostate, we'll say, oh, yes, it is likely the prostate that is causing it. When you say diuretic consequence, does kola nut have such effect? Okay, I know kola nut is a stimulant. I mentioned coffee because it has been established. I am not aware that kola nut is also a diuretic, but I know it's a stimulant just like caffeine in coffee. But it's I'm not aware that kola nut has any diuretic properties. Okay, any more questions?
Yes, I'm trying to send in one. I don't know.
Okay.
I just shared one now.
Yes, it says if the problem is prostate, can a man choose for it to be removed completely? Now that's a very good question, and I want us to listen attentively. Now, even for surgery of the prostate, there is the surgery for prostate enlargement, that is BPH, is different for the surgery for early prostate cancer. The surgery for BPH, we call it simple prostatectomy. Simple prostatectomy. But the surgery for prostate cancer that is early, that is discovered early, we call it radical prostatectomy. These are all prostatectomies. Prostatectomy just essentially means removal of the prostate, but one is simple and the other is radical. And in the simple prostatectomy, you essentially just remove the inside of the prostate. Just imagine you have an orange and you want to remove the inside of the orange and leave the peel outside. That's similar to what you do for simple prostatectomy. That's when the prostate is enlarged. You remove the inside, which is the enlarged part, and leave the outer part, the thin part of the outer part, which is still part of the prostate, but the person will now be able to pee freely and all that. But the radical prostatectomy is the surgery that removes all the prostate. So you come above and below, you cut and then remove the whole prostate. That is the one that gives cure for prostate cancer. However, it has its own risks. That's why we cannot do it. We do not do it for for benign prostatic hyperplasia. It's done when you suspect cancer, and it's in cancer that you want to remove all the prostate. So yes, there's a surgery to remove the whole prostate, but because of the risk, the surgery is more technical. The risk of some conditions like incontinence, erectile dysfunction is higher with the radical prostatectomy. So that's why we don't just do radical prostatectomy for every man, except when we know there is cancer. In that instance now, the benefit of the surgery outweighs the risk of the surgery. So yes, it can be done. Prostate can be removed completely, but typically that's done for prostate cancer surgery.
Okay, I have a question. Let me just show this one before we go to another one.
What can you say about laser treatment? Yes, laser treatment is one of the ways that we treat the prostate. So we use laser for minimally invasive surgeries of the prostate. Typically, we call it, there can be laser. Okay, now I'm tending to sound technical. There can be laser enucleation of the prostate, which we call the HOLEP, holmium laser enucleation of the prostate. But laser also can be used for some other forms of treatment of the prostate. Now, what laser does essentially is that it helps in simple prostatectomy. The simple prostatectomy can be done either open. When we say open, we mean you cut open and remove the prostate. It can be done section of the prostate.
Network.
It cuts it. While there's also the laser treatment, which can be used to remove the prostate, either enucleation or sterilization. So laser is typically used for treatment of benign prostate hyperplasia, not for prostate cancer. If it is used for prostate cancer, it is not for cure. It is usually just maybe to free up a channel so that the person can pee freely, not as treatment for the prostate cancer.
So perhaps this may be the last question because our time is far
Okay.
fetched.
Yeah. Please
It's a question
explain
on the
pelvic
screen.
pain versus. Okay, I can see a question. Please explain versus waist pain versus back pain as it relates to prostate issues. Now, for pelvic pain is deep seated within the pelvis. It can occur as from prostatitis. Prostatitis can cause chronic pelvic pain. Even prostate cancer, as it advances, if it involves the nerves, it can cause some form of pain within the pelvis. So that one has pain, but let's not forget, I said prostate cancer in its initial stages, it's asymptomatic. So don't wait for pain before you say I have cancer. In fact, most cancers are painless. Inflammation of the prostate comes with pain. So prostatitis comes with pain. So that's more likely to cause pain than prostatitis. But let's not forget, when individuals have prostate issues, even the benign prostatic hyperplasia, because urine is not flowing freely, they can develop infections because anywhere fluid flows in the body, if anything stops that appropriate flow of that fluid, infection can occur. And infection is usually painful because it causes some form of pain. So yes, even individuals that have prostate issues, whether BPH, may have some form of pain, whether during urination or deep within the bladder because urine is not flowing freely. So pelvic pain can occur in all of these. Waist pain typically can occur in prostate cancer when it has spread. In fact, the bones of the lower back is one of the earliest areas that prostate cancer spreads to. So you find out that it spreads to that area and begins to give the person low back pain, of course, which we refer to as waist pain. So yes, pain can also occur from spread of prostate cancer, but that doesn't mean, let's not forget, as one ages, there are also changes that occur in the spinal cord, and it can affect the spinal cord of the lower back. So that can also cause some pain. So that somebody has low back pain, even if he has prostate issues, does not conclusively mean that they have a spread of cancer to that part of the back. It may still be something else. So let's not panic. Always get to see your doctor. They will tell you the investigation, which is which. And the more you know, the better to be.
So thank you very much. There's a last question, but the question has been answered. It's talking about where do people feel pain, and from what you have explained, I guess that answered it. So for those of us watching, can we use the best of our time to thank? I think there's one. Sorry. I missed one. I missed one. Sorry. I missed the question. Sorry. Can you see this?
Okay, yes, I can. Anytime I eat starch
Okay.
food like semo or amala, I urinate more than eating any other food. I don't think, from my understanding, I don't think semo or amala will cause one to urinate more frequently than usual, from what I know, because they are starch. Except, of course, if as you're eating it, you're taking plenty water, which may explain why you're urinating more frequently. But I'm not aware that that will cause one to urinate more frequently. Probably you take plenty water if you're eating it, and of course, urine will follow the more fluid you take.
So thank you so very much. Audience, can we all thank our guests? Can we clap, show love, say thank you? I want to hear people saying thank you. Are you blessed? Did you get value? Please say it in the comments so that our guest knows that it has been useful to us. So do
My
you give
pleasure.
value?
Thank you very much.
I've seen some comments relating to people gaining value, but maybe because I had to change. Aha, we have one here. Uh, Ebenezer says, "Thank you, doctor." Is it showing?
My
Oh,
pleasure.
what's wrong? Okay, yeah. Ebenezer is saying, "Thank you, doctor." Uh, Kenneth Thomas, they said, "Thank you." So let's see. Yes, here we are. Okay, yes, a full comment. This was a very insightful session. I've really gained quite a lot. Thank you so much, Dr. Sofa. God bless you. Looking forward to more sessions with you. We
My
have
pleasure. Thank you, Kabir. Thank you, Kabir Hudu.
we have Musa telling us, thank you, doctor. We have
Thank you, Adolfo.
Olakunle.
Thank you,
Thank you.
Adolfo.
Thank
Thank
you
you,
very much,
Olakun.
doctor.
Thank you, Oladokun,
I
Olakunle.
think there are a lot of comments thanking you for this session. So, on behalf of the members of the group, I want to say thank you so very much for giving us this opportunity to get to learn more about prostate health, get to know what it is, the risk factors, the type of problems that may occur with it, the what we need to do, the action we need to take, and especially the call that we need to take action and now and now. So we thank you so very much. We know you should be spending time with your family, but we are taking you away for 1 hour plus, and we are very, very grateful. God bless you. God bless you. God bless you real good. I think the people are
Amen.
happy, men
Amen.
are
Thank
happy,
you. It
and
was what you were.
we say when you need help for yourself, God will raise men to help you. So we thank you so very much.
Amen.
God bless you.
Thank you. My pleasure, sir.
Thank you
Have
very
a great
much.
day. Thank you, everyone. It was all my pleasure. Have a nice day.
Thank you. Thank you. All right. So today we are done with this session. It has been quite helpful, and like I told us, it's here to make a big difference. Men should learn more. Men should know about themselves and live better lives. Okay. So this recording is available, and I want to call on us. Subscribe before you leave this call. Subscribe to this channel. We'll be discussing a lot of things here. This place is called A Place for Men. A Place for Men. We are going to be discussing a lot of things that will be useful to us as men. The recording will be here. I will share the link for those who are not here. So thank you very much for showing up. Thank you, thank you, thank you. Let's do it again next time with another professional. I'll still talk to him. If he has time, he might come up to talk about prostate and sex. Prostate and sex. So thank you very much. Have a beautiful evening. Rest well. Take the advice. Go for tests. Get examined, especially if you are 40 and above. Bye-bye. Thank you very much. Thank you, guys. Thank you for joining.